Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We are back with another Business Solutions podcast, and we are going to present to you some information that also ties into an upcoming MGMA webinar. I want to give a plug for that. That webinar is Reducing Physician Practice Administrative Burden, Real-World Results from Implementing e-Signature for Home Health Orders. So to put that on your calendar, that is July 31st, and that event is sponsored by Forcura. And we have some people from Forcura today joining us today. Kate Warnock, Senior Director of Communications, and Maya Vojnovic, a product expert also at Forcura. I just want to welcome you both to the show.
Thanks so much. Great to be here.
All right. So let's get started. As we do with all of our podcasts, we want to get to know a little bit about our guests. So Kate, I'll start with you. I'd love to just get a little quick intro to understand who you are and what your background is, just to share that with that MGMA audience.
Oh, thanks so much, Daniel. So as you said, I'm Senior Director of Communications and also Brand Strategy here at Forcura, which is a healthcare technology company based here in Jacksonville, Florida. Before joining Forcura in 2019, I've really spent my entire career in the healthcare industry. So that's now 23 years, because, I started when I was 16. So I was on the payer side for the majority of my career and kind of came up through all sorts of change, everything from HMOs when they kind of first launched all the way through the Affordable Care Act, and then came to Forcura, like I said, in 2019. I'm now on the technology side and just find this sector endlessly fascinating.
Well, fantastic. Maya, same with you. Would love to hear about your background.
Absolutely. So I started off on the more clinical side, and I studied health sciences in college, and I spent time working in clinics throughout my college career. And then afterwards, I transitioned over to public health during the peak of COVID, actually, where I served as a liaison between one of the Florida Bureau of Public Health laboratories and the software company. So now at Forcura, I am the product owner for Circle, which is our e-signature platform for providers. And I absolutely love what I do because I can hear what providers and their staff need to deliver better patient care. And I get to help enhance Circle and deliver solutions to meet those needs.
All right. Great. Thank you so much for that. Now, Kate, you mentioned a little bit about who Forcura is, but if you don't mind, elaborate just a little bit on that and how the company fits in with what our listeners, our medical practice administrators, what they're about and how Forcura can help them in their jobs.
That's great. Well, so Forcura launched as a healthcare technology company back in 2012, and our sole focus from the early days has been on the post-acute sector. And so we're a technology platform, we're B2B, that serves really primarily the home-based care providers. So think home health and hospice and personal care, that sort of thing. And really, we are that intelligent healthcare workflow solution that helps really better manage that patient journey once they're discharged from, an acute setting, or if they're referred in from a community physician. We manage all of that documentation. We build in some intelligence there so that our clients can really use better intelligence to make business decisions that are best for them and for their patients. And then on the back end too, Daniel, we also help to manage that flow of documentation out to physician groups. So that's why we're here today, is talk a little bit more about that. One thing too, I would be remiss if I didn't say, we were just recently acquired this year and are merging with Medalogix, which you'll see in our virtual background here. And Medalogix is really that leading clinical decision support technology, also for home health and hospice groups. So really exciting merger. We're just at the start of integrating our solutions, and but we're here today really to talk about Forcura Circle, which is Maya's expertise.
Wonderful. Okay. Thank you so much. Yeah. And one of the main things we will be talking about is a partnership that the company had with Fierce Healthcare. This was on a survey of physician practice leaders. Share with us, what were you looking to find out from this survey, and maybe some of the nuggets that you did find out?
So I'll kick off here. It was my project, and it was such a real delight to really kind of dive into getting firsthand feedback from people like your audience that are listening today. We really wanted to quantify something that we think might be flying under the radar for a lot of practice managers. And that is, what challenge is it for them, their staff, their physicians to coordinate care for post-acute patients? So as that documentation is coming into their offices by faxes, by emails, through portals, all the things, there's a lot of work that goes into that. But a lot of people may not be aware just how much time and cost goes into managing what tends to be a very manual process. So that's really what this Fierce Healthcare report helped us do. We surveyed and got 111 people to reply and produce all sorts of insights for us.
Right. Maya, anything else you want to share about it?
Yeah, I just wanted to add that we also hope to capture some open text responses to questions like what EHR functionality is most needed to help you better manage coordinating care with your post-acute network. And this is like the ability to send electronic referrals for healthcare agencies. And our products are purpose designed around our end users. So we take direct feedback from those end users. And so this audience was instrumental in helping us guide our product development.
Okay. Well, Maya, let's stay with you for this next question. So according to the information, 1/3 of practices are spending 10 or more hours a week on documentation tied to post-acute care. That's a lot of time. That is a lot of time being put into that. So what does that mean in practice, and how does it impact patient care or even team workflows?
Yes, definitely a lot of time. It means that time is taken away from patient care, and that can result in delays for patient care coordination and provider payment. So being such a regulatory-driven industry, there's a lot of paperwork involved in the post-acute care world, and there's a lot of manual effort. So physically signing each order, the time-consuming process of sending documentation and waiting on confirmations, and manually tracking documents on an Excel spreadsheet, it's all very time-consuming. Actually, over 1/3 of practice managers report that their practices have between 5 and over 7 or more staff members managing referrals. And that's also phone calls and faxes, all for the care coordination process. So the time and resources needed to manage this document workflow poses a financial burden, because not only is it resource expensive, quote unquote, but also because of the delays they create in returning signed orders. Delays means that the provider is not getting paid for the patient care that they provide.
Okay. You mentioned phones and faxes there, Maya. Kate, I want to turn it to you. What we're learning is phones and faxes are still widely used. They are still in great demand. Let's talk about the strain that can put on practices and how these more modern technological tools can be used to help relieve some of that pressure.
You know, Daniel, as Maya was kind of ticking through those things that we found through this survey, I really bet that a lot of the people listening today were shaking their heads like, that's my practice. Yeah. And they can speak to the pain a lot more eloquently than I'm sure I can. Yeah. But, you know, again, what we discovered is that this does tend to be it can be very overwhelming to get bombarded with phone calls that are followed up with emails and another ream of faxes that, if you are doing this all manually, if you're tracking these things in a spreadsheet, you might have to be physically tracking down who has what copy of what version of this patient's order, which again, it's frustrating, and does not make people feel like they're adding value to what they really want to be doing most. So, you know, again, as we talk about where we see this industry evolving and why we're here today a little bit, is that when you can start to introduce technology that helps to consolidate the process, it's one place for everyone to go into as a source of truth. You really start to eliminate that volume of phone calls and faxes and such. And one thing that Maya mentioned too, I'm not sure that this audience is as aware of, is that especially if you're a home healthcare provider, because of the regulation, even if they've already delivered those services to your patient, they're not able to bill for those services until they get this physician signature back on their record. That then triggers their billing. So if you think about the expense of paying for your staff, your clinicians, to go out to the patient, to make multiple visits, to pay for supplies, all of the back and forth, that's a lot of financial outlay on our client side. What we're seeing on the other end of this transaction is all of those same inefficiencies, but not necessarily a lot of incentive for the physician practice to be managing that documentation in a timely manner. So Maya, I think, is going to speak to that a little bit later, but that's, again, the incentive for why your practice managers that we're talking today are getting all of these phone calls. It's because they need to get that signature so that they can then do that proper step of billing with that physician signature on record. So that's a little bit of education that I'm not sure everyone was maybe aware of.
Okay, thank you for that. So Maya, I want to turn to you for the next question. One of the things that really stood out was system fragmentation. That is something that was really out there. And one of the numbers that really stood out was some practices reported, I want to get this right, managing 15 or more portals just for post-acute care. So much fragmentation there. Talk about that and the risks that are involved in that.
When providers have to access the different portals for each post-acute agency, each of which has different requirements, different login credentials, different links you have to bookmark on your browser, the systems are certainly fragmented. And I can imagine how much frustration that creates in a clinical setting. So as a result, patient information can also be fragmented because it resides in multiple systems. And that continuity of care can sometimes be lapsed. The time-consuming process of managing this administrative side of countless portals is yet again taking time away from patient care. And it's not just the providers who experience this, it's also the home-based care agencies, with everything being aggregated on their end too. And so there's not a central place to manage all the documentation. It's kind of dispersed all over, and it's definitely a pain point all across the board.
Okay. Kate, another number that stood out to me from the survey, only 7% of practices said they're very satisfied with their current coordination process. So 93% are not very satisfied. What is getting in the way of improvement? What's happening there?
Isn't it shocking to hear that there are 7% who are very satisfied, given all the challenges that we've just ticked off? So kudos to them. And I'm glad to hear that there are some folks who are finding this not really just a burden and overwhelming. But, your question was, what's getting in the way of improvement? I think that there's probably so much that's going on in the back office of a provider practice. And this may not be an issue, again, a challenge that's recognized for creating the burden that it truly is. So I think what's getting in the way of improvement is just a general awareness issue. There's a gap between this is the way things are and understanding the way things could be. And so that's what we went in with Fierce Healthcare was, again, to really capture what are the challenges and then to really start to quantify it so that we could help to educate this sector, our practice managers, and say, does this sound like you? This is a really horrible process. And let's start to have a conversation about how things could be better.
Yeah. Maya, another thing to bring up here, nearly half of the respondents didn't know that they could bill for oversight of post-acute care. So what are the billing opportunities that our listeners should be aware of?
Sure. So the Healthcare Common Procedure Coding System, or HCPCS codes for short, they're used to bill for care plan oversight of post-acute patient care. For Cure, the Circle platform has streamlined and centralized reporting for these codes, plus some additional data points like the primary diagnosis, time spent per care, and date of service. And so with this reporting feature in Circle, it's built into the platform and gives the provider billing opportunities for that post-acute patient care. It can offset also the administrative costs for practices if they do start billing for care plan oversight.
Okay. Kate, let's talk about one more opportunity that we found in the study here. The survey highlighted demand for electronic referrals and real-time tracking. So let's talk about those opportunities and how those could be integrated for medical practices.
So for sure. So I think that there's just a general demand for less paper in an office environment, something that's more centralized. So if what we're seeing is we're talking about and we've quantified what's happening at the end of this one transaction where we have a post-acute provider sending documentation that needs to be reviewed and signed and returned. That's the patient care plan. But what better could happen, in the future as more of these communications become both digital and real time. Well, what you're going to get, again, less paperwork in the office and a lot more opportunity to focus on what counts most, which is that patient care. So this is really the direction that Forcura Circle is going in. And, part of our excitement about merging with Medalogix, we know down the line, we really want to serve up patient insights. So be able to share in real time, not just an order about this is the care that we are planning to deliver or our clients are planning to deliver, but for physician practices to know my patient is getting this sort of service, or there has been maybe a change in that patient's care outcome. Maybe they've had a degradation of their clinical condition. This is something a physician practice wants to know as much as a home health care provider does too, right? So this is one patient that's being managed by, a many different care stakeholders, but we really see that primary care physician practice as the quarterback. And so being able to put technology in the hands of both of these stakeholders, all of these clinicians, and again, have one place where patient information can flow seamlessly. That's really what the future should be, and that's where Forcura is working towards.
Okay. I have last question I want to ask, and I want to direct it to both of you. We'll start with Maya and end with Kate, but we've been talking a lot about post-acute care coordination, but what's a realistic first step that a practice can take if they want to improve the way that they handle those processes? Again, Maya, let's start with you.
No, I would say consider licensing for Forcura Circle. It's a one-stop shop for your entire practice. Our new admin and connectivity features we brought out allow practice managers to centralize all the work they need for the entire practice. One of my favorite things about it is that practices can have access to multiple, if not all, agencies in their post-acute network in one portal. And I think that's a really big deal. And then kind of how Kate alluded earlier, using Circle can improve the relationship with this post-acute network because we see our e-signature platform reduce order turnaround time by over half. And then plus, in addition to the new enhancements we have made, practice managers now have visibility for documents belonging to all the providers in your practice. And so we've created this dashboard with the holistic view of all the outstanding orders and have really broken it down by provider, post-acute agency, and many more data points. So I think that'd be a really good step.
Yeah. And Kate, let's hear from you. Have the last word here.
Yeah. So just kind of building again on what Maya said, part of what that survey did, it really helped to key us into what is it does the physician practice manager need for her to better manage the clinicians, her staff, that sort of thing within her work environment. So as much as this is meant to help benefit the patient and making sure that that documentation is seen quickly, we also want to remove some of those burdens from that physician practice. So specifically being able to minimize the administrative burden that's on the physician and put it on the staff that's really designed to manage those things. So, whether it's the portal logging credentials or managing sort of adding or deleting their staff, that's something that one person is able to do across the entire practice. So we thought that was really important. And then obviously maximizing the control that you have over your administration of your entire provider group and your reporting. Again, to have this all instead of disaggregated and in so many different places, one place to get this information so that you can really administer your practice with that much better clarity and efficiency. So really starting with Forcura Circle is our number one piece of advice.
That is great. Well, I want to thank Kate Warnock, Maya Vojnovic for joining us today. Thank you both so much. This has been great.
Thank you, Daniel.
All right. Now, everybody, a quick reminder, Forcura is sponsoring an upcoming MGMA webinar. It's going to be on July 31st. I do want to remind you, it is called Reducing Physician Practice Administrative Burden. real-world results from implementing e-signature from home health orders. We're really excited about this offering. It's a free webinar. You do get continuing ed credits for that. What I'm going to do in the episode show notes is put direct links in there. All you have to do is click that link and go right to it, or you can go to mgma.com/webinars and you'll find it there as well. So, everybody, I just want to thank you again for being MGMA podcast listeners. We'll see you next time. Thanks so much.